deadly Ebola virus that hit West Africa in late 2013 affected over 28,000 people in multiple countries, causing more than 11,000 deaths and sending shockwaves worldwide. The difficulty in controlling the spread of the Ebola virus led to renewed calls for greater cooperation between agricultural and health workers. Funded by the Royal Netherlands Embassy in Accra, the program Preparedness Against Ebola and Other Emerging Infectious Diseases in Sierra Leone and Guinea introduced a new, more integrated approach towards disease monitoring and preparedness that brought many parties together. The project is a unique collaboration between various institutes to work on One Health initiative and South-South cooperation.
So the One Health approach briefly is an interdisciplinary approach to public health. And it's about tackling public health from an animal health, human health, environmental health angle altogether to increase the effectiveness of the three types of health, but also brings in different disciplines. The thing that is unique about this project is that it really brings One Health where arguably it's more effective, which is at the community level. So there has been a lot of effort in having a One Health approach to public health at the really national level, but in this project we bring it to the community side, which is where the beneficiaries are.
The project has three main work packages: enabling community surveillance, strengthening laboratories, and results-based financing of health services. The aim of Work Package 1 is to develop an innovative system for prevention, preparedness, and resilience of Ebola and other emerging infectious diseases. The teams work directly with partners on a One Health program addressing community engagement and surveillance from an integrated animal and human health perspective.
In Sierra Leone, people, I should say, they live with the animals. Livestock is part of their daily lives. And almost all of the farmers in Sierra Leone, they keep few animals with them. In case of emergencies, when they need money to pay school fees, to settle medical fees, they usually resort to selling some of these animals to take care of these financial activities. So they are very close to the animals, I can assure you of that.
To make up for a lack of qualified veterinarians, animal farmers were trained to become paravets or community animal health workers, and they act as the first link in the new disease alert system.
They met us sometime in December that we should do a pilot of community animal health workers. These community animal health workers will be involved in the day-to-day surveillance of animal diseases, because according to research, out of any 10 diseases that affect humans, 7 come from animals. It was a 23 days training. During that 23 days, we trained them as community animal health workers. Basically, they are to look for animals that are sick in the community. Suppose, let's say one of the diseases that affect our people in the community is rabies. It's a viral disease. It kills humans, it disturbs population, it disturbs farming communities. So we taught them how to detect diseases and how to administer basic treatment. And for now, they have started treating. So the animal health is improving bit by bit.
Work Package 2 aims to strengthen the laboratory services, including their quality assurance systems for improved preparedness and resilience of Ebola and other emerging infectious diseases. Parts of the project included the renovation of a Njala University Veterinary and Public Health Laboratory as a functioning Biosafety Level 2 lab. The South-South cooperation is realized here by the technical assistance of the Noguchi Memorial Institute of Medical Research in Accra. Staff were trained in biosecurity, biosafety, good laboratory practices, and PCR and serology techniques.
This laboratory is not only for that. This is a university. All students coming from animal science department, we have to come and do practical. So by the time you are leaving Njala University, you'll be able to do serology, you'll be able to do PCR. I mean, you have some idea. So this will be a springboard to train our staff to work in the hospitals and all the laboratories in the country. As a laboratory, we are working on animals, so you don't have no right. It is unethical for us to draw samples from humans. So the humans, the medical people deal with the human beings. We have some blood samples here that was collected by the Moyamba District Medical Team, which we have to analyze for Lassa, for Ebola, and for Rift Valley fever. So the human people deal with humans and we deal with animals. But we can analyze it. So that is a One Health. We are not only dealing with animals, we tell the people what is the disease that the animals have, how they can protect, and we also link with the hospital. So we are linking with the hospital, human aspect, we deal with the people in the communities. That's exactly a perfect One Health situation.
The aim of Work Package 3 is to strengthen the interface between the health services and the community. One promising avenue to improve service delivery is through results-based financing. A results-based financing model was developed for Guinea, with the Ministry of Health and Public Hygiene taking the lead role. This model is being piloted in Mamou District, Guinea, and includes the training of providers and verifiers as well as the development of training manuals.
Depuis le lancement de ce projet, nous avons constaté beaucoup de changements au niveau des agents de santé communautaire. On les a trouvés individuellement et avec l'approche ZPR, on a créé un groupement des agents de santé communautaire. Ils étaient dans le bénévolat, mais maintenant avec l'approche ZPR, ils gagnent des subsides en fonction des résultats.
Dans la pratique, ça veut dire que si avant la femme qui venait faire la consultation prénatale ou bien la femme qui venait accoucher, à partir de la fin de l'accouchement, n'avait plus de lien avec la structure de santé formelle, mais avec le RBF, nous avons développé, il y a des mécanismes qui sont développés, non seulement la femme qui vient pour la consultation prénatale, il laisse son adresse, la femme qui vient accoucher au centre de santé, elle a son adresse, donc les agents communautaires qui travaillent avec la structure et la communauté, si la femme qui vient pour la consultation prénatale, elle n'est pas venue à la date indiquée, l'agent communautaire peut se déplacer pour aller savoir dans le ménage qu'est-ce qui a fait que la femme n'est pas venue.
4 years later, the Ebola outbreak has been contained, but there remains a risk of future outbreaks from Ebola as well as other emerging infectious diseases such as Lassa fever, dengue, cholera, Marburg fever, and yellow fever.
Yeah, definitely. We're more prepared than we were before Ebola. You know, Ebola caught us unawares. Now we are in a better shape than we were in 2014 when Ebola struck. Like I told you, we have the rapid response teams now. We have the emergency operational centers, both at district level and at central level. And there's a telephone number you can call in case there's an outbreak. And now the people have been sensitized since the last outbreak. They know what they are supposed to look for and what precautions they have to take. So I think we are better prepared now than we were before the Ebola struck.
The biggest achievement is the capacity that we have built. Yes, the lab structure is there. We have put in equipment, but the human resource that we have instilled into them, how to test for this basic viral agent, to me is the biggest achievement we have made there.
The KIT coordinated program contributed to strengthening community and social systems and raised knowledge and skills within communities, agricultural and health systems, enabling countries to react more rapidly and effectively to any future outbreaks.